But first tonight, we just received some new coronavirus numbers as Austin enters stage 4 risk-based guidelines. Now that Austin's 7-day average is above 20 daily COVID-19 hospitalizations, it's asking people to become more vigilant out there. It's come to the point where even the mayor says if a business isn't requiring people to wear masks, you should just go somewhere else that is. Just in tonight, Travis County says it added 119 new cases and the 7-day hospitalization average is now 22.6. Williamson County had a record high 56 new cases. The previous high was 51 on April 26th. Hayes County had 69 new cases. Saturday was 142 new cases, Sunday 54. And Caldwell County jumped from 87 to between 133 and 147. DSHS is reporting 147, but only 133 have been confirmed so far by the local Office of Emergency Management. The spike is from nursing home testing in Luling last week.
Austin Public Health wants to more than double its number of COVID-19 contact tracers. Cases of the coronavirus are increasing locally and statewide, including cases tied to bars and restaurants that have reopened. KXAN investigator Kevin Clark spoke with a restaurant group that is doing its own contact tracing.
Austin health officials say their latest challenge is a delay in COVID-19 test results that in turn delays letting other people know they may have been exposed.
It's not uncommon for us right now to be notified of a new case, confirmed case, that was tested a week ago that had onset of symptoms 3 or 4 or 5 days before that.
Still, the city needs help with contact tracing. APH hopes to hire 115 tracers. Right now, it has just 48. It's a need exacerbated by the state's reopening and a subsequent surge in cases that hasn't spared Austin. For example, the city recently identified 4 clusters tied to restaurants, which can now operate at 75% capacity.
What we need in Austin, where we have a certain level of density and we have an attractive bar and restaurant scene, is to be moving through these phases a little more cautiously.
Adam Orman is the GM of Loca de Oro and is part of the group Good Work Austin. The nonprofit includes more than 40 restaurants that have put together stricter guidelines that go beyond the states. They include mask requirements for customers unless they're eating or drinking, more distance between tables, and for customers to sign a health declaration. The most practical reason for this, restaurants can contact customers if one of its employees gets the virus.
It makes it feel all the more necessary. The more we see what questions are arising. Like I said, the more we see restaurants being attacked for having to close after they've already opened.
Kevin Clark, KXAN investigates.
You'll find all those restaurants that are going above and beyond at goodworkaustin.org. Austin 311 tells us it's received 21 complaints related to social distancing and over-occupancy at businesses just this past weekend.
Austin Public Health says it is investigating at least 19 clusters involving 55 people. That's just between May 21st and June 4th. These don't count any nursing home settings. A cluster means 3 or more cases. Food service is the only classification with 4 clusters. General contractors is the only classification with 3 clusters.
While some restaurants are making public announcements, there's no rule requiring them to inform customers when employees test positive.
A lot of the law about COVID-19 and what you have to do in response to COVID-19 is really still being written.
Brad Nitschke, partner and chair of the COVID-19 task force at Jackson Walker, says employers must consider whether other employees were exposed, whether customers were, and whether their regulatory or licensing authority has standards in place.